Hi, hope you guys are all doing great. In this video, we'll have a brief textbook review on the topic four-handed dentistry, for which I'll be referring Oxford Handbook of Clinical Dentistry, 5th edition. So in four-handed dentistry, we'll look into the role of dental nurse. Along with that, most importantly, the operator and chair positions, as well as the position of the dental nurse, right? Briefly. So four-handed dentistry, working in a seated position, is now the norm for all the dentists. This has resulted in the dental nurse taking a more active role by working closely with the dentist. In fact, this is one of the important points I want you to make a note of it. The development of four-handed dentistry is credited to Ellis Paul. And the advantages include the following: increased patient comfort, as well as comfort to the dentist as well as nurse with this four-handed dentistry concept, increased efficiency, operator visibility, reduced chances of backache because of the position which we'll be discussing a bit later, and increased professional satisfaction both for the dentist as well as dental nurse. Unfortunately, in our setups, usually in Southeast Asian nations, especially in Indian dynamics, dental nurse or dental assistant, they are taken for granted. But in Western or European culture, where I've seen, like they have a very active role, as already mentioned in the book. Seating the patient. First, let's look into the patient seating. Except for the old, infirm, or pregnant patients, a totally supine position is preferable. Remember to warn the patient that you are about to whisk them backwards, which we usually don't do, but we should let them know that we're adjusting their chair positions and it shouldn't be a surprise for them. Seating the dentist, very, very important, the operator position. The aim is relaxed, undistorted, comfortable posture with good vision of the teeth that we are planning to treat. Adjust the dentist's stool so that the top of their thighs slope to 15 degrees to the floor. Very, very important, make a note of it. And position the dental chair so that with the operator's back straight, the patient's mouth is at dentist's focal distance, which is almost at our mid-sternal level. Forearm should slope upwards to this point, as we can see in the illustration. The operator's position or location is between 10 o'clock and 11 o'clock, depending on the arch or the teeth we operate, relative to the patient's head. This is for right-handed operators, right? It's understood. Ensure that the patient's head is at the top of the headrest. So we have a couple of important points. Hope you made a note. And seating of dental nurse. Some key takeaways. The dental nurse or the assistant must be seated comfortably with a straight back, with their eye level 10 centimeters higher than the dentist for maximum vision. The dental nurse normal working environment is to be between 2 o'clock or 3 o'clock, assuming that the operator is a right-handed person, so that there is easy reach of instruments and equipments to be used. And role of dental nurse. I want you guys to just hear this out. To receive seat and look after the patient, to place bib and protective glasses on the patient, to position dental light, to retract patient's lips and protect their soft tissues, to aspirate fluids, and for which they should hold the aspirator in their right hand, holding 3-in-1 syringe in left hand while aspirating, and passing the instruments to the operator. And now when it comes to passing of the instruments, we have this instrument transfer zone. We'll briefly look into that as well. The transfer zone is just in front of and slightly below the patient's mouth, not over their eyes, which is very, very important. There are several techniques which enable the dental nurse to pass and receive instruments effectively from all the dentist, and this all requires practice. There is nothing like a standard rule like the instrument has to be passed like this or like that, but common sense is that when you're passing a sharp instrument, it should be handed over to the dentist and vice versa, so that the working end is not either towards any of them, right? I hope you can understand. Let's suppose we have this following instrument. Rather than handling the instrument like this or like this, why not like this? So whatever it is, each dental team needs to choose, adapt, practice, and perfect a system that safely achieves instrument transfer. So that's the objective of instrument transfer, right? So this is in brief some important information regarding four-handed dentistry. I hope it's useful. So in the coming videos as well, we'll try to incorporate these brief textbook review sessions, so that the objective is twofold. Number one, to encourage you guys to go through standard literature, and number two, the important points that we've picked in the process will help you not only for your university exams but also for your entrance preparation. I hope it's helpful. All the very best. Love you all.